first remind patients where they're going to meet you on their journey to their goals?
Usually you meet me at the pre-op.
Okay. And just briefly, walk us through what kind of are the components of that pre-op appointment and what to expect.
So at first, we just ask you some questions, mostly about your medical history. And then after that, we will get some vital signs, do any pre-op testing that we need to get done. Then we'll do some pre-op photos. And then what I like to tell my patients, we get now down to the nitty gritty. So when you're done with the pre-op photos, you get to get changed back into your regular cozy clothes, and we get to go through how to best prepare you for surgery, what to expect before and after surgery, and go into all the details.
What do you find in terms of patients when they come in for that pre-op visit? What emotions do you see? Are they typically nervous or excited or scared or,
All
and
of the above.
Really?
Yeah. Yeah. We have patients that have come in, they're like, I'm really excited, and they just want to rush through everything. And I'm like, okay, well, we still are going to go through all of this stuff. So let's, we chat a little bit. Or I also get patients who are just really, really anxious and nervous about it.
How do you make them feel a little calmer and able to take that edge off?
One thing I like to do before even starting my pre-op is just kind of chat with them and let them know what to expect. That's what I would like someone to do for me. This is what we're going to do. This is how we normally do it. If you have any questions, please feel free to ask them. They'll likely get answered during the pre-op, but if not, I want you to ask me so I can get it all answered for you. So just being able to kind of hopefully put their mind at ease, any questions that you have, whether you think it's an insignificant question or not, let's get it answered, because there's no questions that are insignificant, especially if it's bothering you.
Also, the moment you as a patient tell your friends, tell your family what you're thinking of doing, they all come up with, oh, I heard my friend Millie or my mom's mom had, and then there's all this stuff that comes at you. And then you're like, oh, am I doing the right thing? And,
yeah,
are those real legitimate concerns to have? And so, and it is better to talk about it because, there is like you say, there's no dumb questions. There's no silly questions. Now, if somebody's too embarrassed to ask a question during the appointment, what would you tell them?
So at the very end of my pre-op, I make sure that they have my card. I also write my name and phone number in the book that we give them, because like I said, I like to tell patients, I like you to have it in two places, because, if you misplace the book, at least you have the card, or you misplace the card, you have the book. Call or text that number. Some people feel more comfortable texting it because they can actually read what they're writing and send it via text. If that's how you feel more comfortable, whatever way you want. It also has my email. Feel free to email me. I'll answer it.
Yeah.
So any way to make you more comfortable, just let us know.